Hello, everyone, and welcome to our monthly community podcast. My name is Annalise Mares, Health Promotion Specialist with Siouxland District Health Department. Today, joining us again is Ana Lopez and Elizabeth Hanson, who are going to be talking about breast cancer and why it's important to get those screenings. So welcome once again, Ana and Elizabeth. You guys were here before a couple of months ago. Would you mind reminding everyone of what you do here at the Health Department and how long you've been at the Health Department?
My name is Ana Lopez, and I work with the Breast and Cervical Cancer Early Detection Program. I've worked that program for 11 years, and that's how long I've been working here at Siouxland District Health.
Hi, I'm Elizabeth Hanson, and I've been at the Siouxland District Health Department for 5 years. I've been working in the Care for Yourself program for a year, and I also work with the VFC program, Vaccine for Children program.
Thank you. So October is Breast Cancer Awareness Month. Can you tell us why it is important to get breast exams and get screened for breast cancer?
It's important because it saves lives. I mean, the screenings don't prevent cancer, but it can help find cancer early when it's the most treatable. In 2022, there will be, or it was estimated that 2,825 new cases of breast cancer would be diagnosed just here in Iowa women alone, and out of those cases, 405 would die from that disease.
Wow, that's a lot.
It is, and it's really sad because it's so preventable.
It is,
yes.
Yeah. So here at the Health Department, we do have a program called Care for Yourself, which helps reduce the number of deaths from breast cancer. Can you tell us a little bit more about that program?
Yes, it's nationwide. It's called the Breast and Cervical Cancer Early Detection Program, but here in Iowa it's known as Care for Yourself. Mm-hmm. And here at Siouxland District Health, we serve 7 counties, which is Cherokee, Ida, Lyon, O'Brien, Plymouth, Sioux, and Woodbury. It is designed for women that are 40 to 64 years of age. But if a woman has any pain, a lump, or any discharge, something that's not normal for them, then at that point age doesn't matter. Right. We just want them to come in, enroll, and get checked, make sure that everything is okay. So for that program, they do need to enroll every year. I mean, we've had women that have been enrolling in this program since I've been working here like 10, 11 years, and they just need to call, or if they don't contact us, then we call them to make sure that they do get those services. With it, they would get a physical with a PEP if it's needed, a clinical breast exam, and a mammogram. So they do need to qualify to enroll. It is income-based.
Okay.
Yeah. So, and then after they're approved, then they would go in for their appointments usually it's with their regular doctor. We're very fortunate that the counties that we serve, a lot of the medical clinics and hospitals are Care for Yourself providers. So there's no issue with transportation because it's usually within their own community around where they live that they go for the services.
What if they don't have a medical provider that they are already seeing?
Then at that point, we would suggest somewhere they would go, which usually would be a community health clinic.
Okay.
And we get them in with a provider.
You guys help schedule like that appointment and get them enrolled in that?
Yes. Once they are approved, we schedule their appointment. Then they would get a ID card, which is a little pink card with that they need to show to the provider and to the mammogram clinic that they go to. And they also get a consent form that they need to sign, and we must have that consent form in our office for them to be considered fully enrolled.
So what if additional tests are needed after the initial screening?
Care for Yourself will cover those extra tests, like diagnostic imaging, like ultrasound, diagnostic mammogram will be covered. Also, if an MRI is needed, the program will cover that as well. Diagnostic procedures such as like cyst aspiration, biopsies along, surgical consult will be covered by a program as well.
Okay. So does a participant need to have insurance in order to qualify for this program, or is it only for those that don't have insurance? Is it for both?
No. Well, they whether they have insurance or are underinsured or no insurance, as long as they meet the income guidelines, they can enroll. And we are a certified, qualified entity, or if a woman does not have any credible health insurance, and unfortunately they are diagnosed with breast cancer, we can enroll them in presumptive Medicaid, which is Medicaid for 2 months, where they would get full coverage, which that would be hopefully enough for them to get either surgery or some form of treatment.
Okay. And where can someone find the income guidelines to qualify for the program?
They would find it on the IHHS website, or they can just call us here, and we'll provide them that information.
Okay. Awesome. So, and then also, can they contact you if they have any additional questions, not just necessarily for income guidelines?
Sure. They can call us here at the Siouxland District Health Department at 712-279-6119. Ask for Anna or Elizabeth. And if we don't answer the calls, like we work on other programs here at the agency, we would like to leave, if you can leave your name, your phone number, and a message, detailed message. For example, if you have symptoms or something is not right and you feeling that you need us to know, please leave that in the message. We will get back to you as soon as we can. We prioritize those calls.
All right. Well, thank you. That was some great information. But is there anything else you would like to add before we wrap up?
It is very important for to do monthly breast exam to know what is your normal, and for moms to encourage their daughters to do that as well, so it become a habit for you and for your daughter. Last year we had a 15 and a 17-year-old needing services, so it's very important for you to do a monthly breast exam and to encourage your daughters to do so as well.
Is there a suggested age to start doing breast exams or screenings?
Well, screenings out if there's no symptoms, it's at age 40.
Age 40.
Okay. Depending on the family history and on what the doctor recommends.
Right.
So it's very important to just speak with your doctor about your risks. But self-exams, they can start early. Like Elizabeth mentioned, we had a 15 and a 17-year-old that came in here because they had symptoms. So, yeah, and they did get all the services. Fortunately, everything was fine. But, if you can get them started that early, it'll be good.
Okay, awesome. Well, thank you once again, Anna and Elizabeth. And as always, if you have any additional questions, feel free to contact us at 712-279-6119.